I've just done another really dull moment. I've, you know, when you sort of tune in on your calendar, you press the event, and the thing comes up to join. It wasn't coming up. I was thinking, no, I've got a minute to go. Keep pressing the button. It's not working. It's not working. Started swearing at the computer screen, and then realised it had come up on the other screen, and I hadn't seen it. And it's all fine. I'm here. So, a few headlines before we get into the Q&A. We've got some. We've got quite a few questions today, and some good ones too. And as ever, if as we go through the session, if there's other questions people want to chuck into the chat, then please do so. So a brief resume on all things pandemic. As usual, I'm sure you'll have seen the numbers in the national media day by day. I think it's probably true to say that they're at a steady state, aren't they? The number of new cases per day is in the sort of mid 30,000s. The number of people in hospital is reduced a bit actually, from nationally over 7 to sort of mid 6,000 now, and sadly the number of deaths remains, I think, pretty constant at sort of 100, 200 and 150 a day. Just a couple of bits behind those figures. The vast majority of cases are children, young people, kids getting back to school. The rates in the over 60s, those that are most at risk of severe illness and death, continue to fall. And do you remember when we used to talk about the R number? That is roughly in England between 0.8 and 1. And you remember the magic number is if it's above 1, it's expanding. Below 1, it's not. So, and there's a bit of extra detail there. In terms of the response, there's the three things, some of which will come into the detail in the questions, so that the healthcare systems across the country are still being instructed to maintain all the rules around social distancing, appropriate use of PPE, lateral flow testing. We'll come into more detail about that, and we know that is different to everybody's, shall I say, normal lives when they're not at work, where the rules are different, and there doesn't seem to be sort of validity to that stark difference. But it is what it is. I'm afraid I, as much as everybody else, would like to be able for that to change, but that still remains in place. And the emphasis at the moment in the vaccination programme, which has been seen as a massive success production by the NHS, is on vaccinating 12 to 15-year-olds. So our school vax team are busily going around the county offering vaccines to 12 to 15-year-olds, and having an amazing number of people take that offer up, which is great news. And in addition, the booster programme for everybody else has now commenced. And the headline sort of figure to remember about that is that you need to avail yourself of. I think someone might have their mic on. Thanks. Is to get your booster vaccine from 6 months and after, when you had your second dose. So check out when that was, and you'll either get offered the option of a booster from where you had your original vaccinations, or your local GP, because the records will have been shared. And the last thing for now about the vaccine and the pandemic is I just wanted to emphasise that national instruction. So we get quite a few questions of why aren't the trust doing this? Have the trust not done that? We're not ordinarily we get a lot of guidance. We don't get lots of instruction, but in the pandemic that's been going on, and we're still mandated to do things. They're not guidance conversations. They are get on and do it and report back how it's going, and we're held to account along those lines. Away from the pandemic, I just wanted to flag, October's a busy month for those months of or weeks of, and there's some really great work going on across the organisation. The first is, I just want to say a little bit about National Staff Survey. I know that you know that you know that I know, etc., etc. This is a really, really, really important part of the feedback we get from all our wonderful staff and volunteers that do great work for us. And the feedback is takes 10 to 15 minutes. There's an option for free text. It is entirely anonymous. And over the last couple of years, we've increased our response rate quite dramatically. And the challenge today is to continue on that upward trajectory. And because the more feedback, the more responses we get, the more we can respond. And in that You Said Together We Did approach to addressing some of the issues that affect making this a great place to work. So you'll see much more about this over the coming weeks, and please encourage your people to get involved in giving some feedback. I mentioned it's a month of months, so it is Freedom to Speak Up month, and again, a really important part of creating an environment and a culture in this organisation where people feel able to say, I'm not sure about this, or this hasn't worked, or this is an issue, and to get a response and an action without fear of consequence. We've done some good work in the last year, and I'm really pleased that we've appointed Cindy Samanda into the substantive post. And I know she's got lots of events and listening events and other activities that can raise awareness of for everybody about this really important function of the trust. Equally exciting and important to note is that it's Black History Month. Again, some great work that we're showcasing across the organisation. You'll see that we're putting some blogs out from some of our BME staff and their experiences and contributions. And there are a number of events that we're also hosting, across the organisation. Please look out in my messages on Connect for more details about that. Related, that's for next week, you'll have seen also that it's Hate Crime Awareness Week from the 9th to the 16th. We've put some a whole load of posters out with a heading "No Excuse for Abuse," this to emphasise this zero tolerance approach, and a number of different, again, events and pieces of information that people can get up to date on hate crime awareness. Two notes for coming weeks: that it's World Mental Health Day on the 10th of October and Nottingham Mental Health Awareness Week the week following. So Yolanda, that's probably enough from me by way of introduction to kick things off, and then over back to you to sort of host the question. Thank you.
Okay, thank you for that, Jake. Oh, sorry, your name's John. Everybody always calls me Anne-Maria, and I think they call her Yolanda, which is quite bizarre, really. I can't imagine why we get mixed up. The first question, John, is about booster jabs, and also about our staff going into care homes, and a question about exemptions. So if you're happy to take that one, it's quite a long question, which I've shared with you prior to today's event. So I think you've got a fairly succinct response to that. Thank you, John. Yeah,
thanks. Yeah, again, there's a lot of detail in the question, which I won't read out in full. And part of this goes to what I was saying earlier about, for example, booster jabs or vaccination of children. We're instructed to make the offer. Our team provide these, for example, immunisation services, and that's what we'll do. We don't, as an organisation, specifically look into the the specific research evidence that's been published and draw conclusions. That's already been done for us, and whether that's through Public Health England or other bodies. But there was, I just wanted to pick up one quote from the question, which says, in a recent staff update email, John claimed that staff working in private care homes must be vaccinated, inverted commas, to retain their employment according to a government mandate. That does come with a slight caveat. So from the 11th of November, to be enabled to work in the care home sector, staff must need proof of being doubly vaccinated. There are some temporary medical exemptions, which we can, I'm sure, share the link on the government website. But they're medical exemptions, and they're listed a list of specific conditions. And it's not a essentially, it's not a choice that people say, I'm exempt, I'm not having the vaccine. There are specific reasons that you can be. And again, we won't go into the detail of that. But I just wanted to make that clarification that from the 11th of November, that will be the case. And I know that our teams are working with all staff to make sure that that's covered off. To note, we are out to a national consultation on whether this should pertain to other health and care settings too. And I think that might come up in one of the questions later on, the implications of that. So that's just to clarify and respond to that question. Thanks, Yolanda. Back to you.
Thanks, John. A very comprehensive answer. And for those that would like to get more information, I have put the link to the government website in the chat bar. So the next question, I think we've lined up a double act of our Director of Nursing, AHPs and Quality, and our Director of People and Culture. So Anne-Maria, I think you're going to start to answer this question, and then Claire's going to add to it. So the question is about why, when the country's opened up, do we want to pursue a zero COVID policy? And it talks about people getting back to the office. So again, it's quite a detailed question. If I hand over to you, Anne-Maria, to sort of give a précis of that, and then your response, and then Claire, if there's anything to add, that would be really useful. Thank you both.
Thank you, Anne-Maria.
You're welcome, Yolanda.
I don't think we don't even look alike. Anyway, I think it's the Yolanda thing, isn't it? And Anne-Maria. So yeah, I would like to answer this actually. So there's never been a time that I'm aware of, and of course I'm happy to be corrected, but we haven't ever put out that people can't come back into work or come back into their offices or administration bases. And in fact, interestingly, the executive team have continued to come into work, and we've met today again for our meeting this morning. So I can see that the question's directed at why are we not being asked to get back into the office? So all I can say is that is a conversation with the operational management structure that you work with. And certainly from my perspective as the Director of Nursing and AHPs, I have said to people there's a level of flexibility, of course, that's required. We have to be sensitive to the fact that some people have not been able to come back into work if they're shielding or if they're unwell or they've been sick. But from my perspective, we've never said that people should or can't or mustn't come back into work. But I suppose that's the only way I can describe it. But that is a conversation with the team that you are working with and for. But I'm going to hand over to Claire because I may well have sort of like not covered it very well there.
I think that was fine, Anne-Maria. The principle is that we've got lots of people that work in lots and lots of different settings and in lots of different ways across the organisation. So it's very difficult to give a blanket answer that fits all of those scenarios. However, we did encourage people to work from home in the height of the pandemic and before we'd got the vaccination and stuff available. We're now in a position where people can come back into work, but I do know that in a number of office settings, they are managing that locally, for example, so to ensure that it doesn't get too overcrowded, to ensure that people can still work safely and at a safe distance, and to ensure that, of course, people have still got all the right PPE when they are working together and alongside each other, so to speak. So if for some reason you don't feel that you are being allowed to come back into work for some reason, you do need to pick up that conversation with your line manager, and you can also have a conversation with the health and wellbeing team, because there might be some specifics around that just need to be run through with you. But yes, you've covered it. We are flexible about the ways that people can work, and that involves both working from home and working back into office environments. And if for some reason you can't get into your dedicated office because actually it might be too small with today's rules compared to pre-pandemic as to how many people could get into that office, then we do have lots of other sites available from which people can work. So please don't feel you have to stay working from home unnecessarily. And as you said, Anne-Maria, that's been a position that we've maintained throughout. We've always facilitated that. Hope that answers the question and helps.
There's there's another little bit in there that I didn't cover off on the question. The person has said that if you work in an office where you know everybody and they're all vaccinated, why do they have to adhere to social distancing, mask wearing, when that has been finished everywhere else? I just wanted to reiterate, and I know that John said it, it hasn't finished for healthcare. I suppose it's as important as this. Those restrictions that you feel we have in place are in place because that is national guidance for healthcare settings. We have to adhere to that and we have to comply, okay? And if I don't comply, honestly, they give us a really, really difficult time if they find that we are not promoting, adhering, complying to the social distancing, masks and ventilation. Those are the three things that we still have to do within healthcare. So I'm really sorry if it feels that we are holding you back. I'm really, really sorry if it feels that people can go to big events, because he has mentioned sports events. I understand that. I can see that. You know, my poor husband has to go and watch Sunderland Football Club. So, you know, that's a thing that he has to put up with. But in all honesty, I can understand why people feel that everybody else seems to be able to do stuff. But in healthcare, we have still got to be careful. We still have vulnerable patients and we still have outbreaks. I declared 2 big outbreaks only this week.
Thank you, Anne-Maria. And that answers another question that we've had in about wearing masks and why we're still needing to wear masks. So thank you for that. I'm just going to hand back to John now to answer the next question, which is asking whether we're able to offer any assurances to staff who've got ethical and other reasons for not wanting the vaccine.
Okay, thank you. So yeah, I'll read a little bit of this out because I just feel a little bit sad that the questioner's put, I'm sending questions anonymously because the current climate of discussion is that certain opinions, although reasonable and rational, are simply not welcome. So I don't want to give the impression, particularly on this call, that that's the case. You know, sometimes we have to make a decision about the detail of the question and the appropriateness of a wide audience, whether we want to get into the real specifics of stuff. But the question that's been asked, I don't think, you know, it is very reasonable, and so you know, I hope that that's not the sort of vibe that myself or the exec team are giving off. And then there is a question about mask wearing. When can we stop propagating the fear of COVID? We need to learn to live with it, etc., etc. I understand certain advice policy comes down from on high, but could you please offer some pushback to this? So to be really clear about that, we do on a regular basis, as do many of our colleagues across other organisations to get some balance into the conversation. So please don't think as well that it's all one way and that we simply roll over and say, okay, we'll do this. There is a regular dialogue of identifying and steering the right course through this. So we're not, purely on receive and do everything that's asked. The second part of the question, which was important to answer, can you offer assurances to staff who have ethical and rational reasons for not wanting the vaccine that they will not be forced to choose between their consciences and their livelihoods? I think that's a great question, and thank you for raising it. And I'd probably start at the end of my answer. So I would like to hope that we can avoid getting into that conversation with anybody wherever possible. But the start of the answer is that it's referred to my earlier point about, and this is out to national consultation about whether additional health and care settings will be subject to, let's call it a COVID vaccine pass, that you must have evidence of vaccination to be able to work in certain areas, whether that's, I don't know, an intensive care unit, coronary care, an adult mental health ward, a learning disability community team, etc., etc. And I think that's a sort of 5-6 week consultation piece. And at the moment, it's difficult to gauge where that's going to land. I suspect it'll, so this is purely supposition, it'll be something like there will be certain areas where it is mandated, there'll be certain areas where it isn't, there'll be an intermediate number of areas where it's a bit grey, and then there'll be a list of exemptions and reasons. If you do this, this, this and this, then you don't need it. And I think that's will be worked through after the consultation feedback. So it's very much watch this space. I'd like to think that we've got sufficient capacity, sensitivity to individuals that we can avoid that last bit of forcing people between their conscience and livelihood. And so that's just sort of a bit of a window into the thinking behind where we sit on that. I don't know whether Claire or Anne-Maria want to say anything more about that, but at the minute it's a train coming down the track, and it's a bit difficult to be any more specific than what my summary's just been. Thanks, Yolanda.
I've got nothing specific to add to the response, John, but just to reiterate the point that I think that we work in an organisation of lots and lots of people and lots of different views, and it's important that people are able to raise all of their questions, and we accept that there are often different points of view. And Neil has also very kindly offered to ask questions on behalf of colleagues. I mean, sometimes people just don't want to raise it themselves, do they? It's not about because they don't feel that they can't, they just don't want to speak in a public forum like this. So Neil's very kindly also offered to raise any questions on behalf of colleagues as well, which is really helpful. Thanks.
Thank you, Claire. The other thing to mention as well is that we do get quite a few questions through to the comms inbox for these sessions, and we are able to raise them anonymously if that's your requirement. We do try and put that in John's daily message, or sorry, 3 times a week message, to say that you don't have to put your name to them. And in fact, today we've had several that are anonymous. So thank you, everybody. Just keep the questions coming. It's really important that we have these sessions. The next question, Anne-Maria, I think you've partly answered it in some of your responses to the earlier questions, but this one's quite specific, asking if we can now hold, if staff can now hold face-to-face team away days and timeouts, and if so, do they still need to wear PPE?
Yeah, thank you for that. So yeah, you can absolutely hold your face-to-face team away days, timeouts. you can start to introduce those back into your daily lives. That's not a problem at all. So this is how it works, right? If you are in a healthcare setting, okay, so say for example you're having a timeout in one of the big committee rooms, but it's on a healthcare premises still, any of our venues across the county, or Arnold, Large or Wathwood, then you must still adhere to the PPE compliance rules that I've said. So that is still masks, 2 meters distancing and ventilation. Okay, so again today an example would be we've had the executive meeting this morning. We've all sat there with the windows open, all wearing masks, all 2 meters distanced, but we are in the room together. So yes, you can, but if you're in a healthcare setting, you must adhere to those. If you're not in a healthcare setting and you've chosen to go to, I don't know, an away day at the golf club or whatever it is, okay, then I cannot say to you, you have got to adhere to the healthcare setting rules. I can't say that to you. But what I am making is a big plea to be sensible. And please, please don't have big events where you're all in a room together in very close contact. What I'm saying to you is you've still got to be sensible. Ideally, if you're inside, you should still do 2 meters distancing. And personally, I'm saying to you, I think you should still be wearing masks with ventilation as well. If you're outside and you're doing It's a Knockout or something like that, or some sort of sport or anything like that, if it's outside and it's not in a healthcare setting, again, I cannot say to you, you've got to adhere to the rules that we've set for healthcare settings. But again, please, please, please be sensible. Please don't have events where you're all in close contact with lots and lots of people. It can wipe out a whole ward. It can wipe out a whole clinical team if 1 or 2 or 3 people become COVID positive or are then close contacts. And we have had that happen where half a team needed to go off. So I'm just saying to you, please be sensible. Just be really, really sensible about this. And COVID is still out there. People are still being infected, and we are still having outbreaks.
Thank you, Anne-Maria. I was just checking that I was on, taking myself off mute. Claire, there's a question been put in the chat from Neil, but it looks like Tracy Yolanda's just picked that up. So the question for those that aren't watching the chat is about breaks at Rampton. So Tracy said she's going to pick that up. And thank you, Neil, for raising that, and I'll leave you and Tracy to liaise accordingly. The next question, Anne-Maria, you're still in the hot seat, please. Someone's asking the question about when they need to do a lateral flow test.
Okay, so that's not changed since we introduced them in January. Important to do 2 tests a week. Ideally before you go to work. I tend to do mine on a Tuesday and Friday. That's how I do mine, and then I record it. I would like to emphasise that if you are off sick, or if you are, if you're off sick, if you've got COVID, or if you are on annual leave, there is a button to press for exemption, okay? So that you won't keep getting the email saying you haven't recorded, you haven't recorded, you haven't recorded. So that exemption button is really important because it allows you just to put in why you're not recording your lateral flow tests. So yeah, please, twice a week before you go to work, please record.
Fabulous.
I can see a question there on the right hand side, Yolanda. Do you want me to?
Yep, go for it.
Yeah, so the question is from Hanny, which is a good question. Is breakaway course still face-to-face, please? Do we need to attend, please? The breakaway course is face-to-face. In fact, the only reason I know that is I did mine 3 weeks ago. So yes, it is face-to-face. And do we still need to attend? Yes, you do need to attend your breakaway training.
Very succinct answer, thank you. And thank you, Hanny, for raising the question. Claire, I'm coming back to you, if that's all right. How soon after having had a flu jab can you have the COVID booster jab, please?
Thanks, Yolanda. I'll come to that. Just to say as well, on the breakaway training, the relevant adjustments have been put in place to make sure that that training, whilst it's face-to-face, is safe. So it has been altered accordingly. But yes, you do still need to attend, please. In terms of COVID boosters and flu vaccinations, you can have those at the same time. There isn't the requirement to have a gap between them. There was some consultation around that initially and some discussions whilst I did some further testing around the vaccine, but it has been confirmed that you can receive your COVID and flu vaccination on the same day and indeed at the same time if that's possible for you. So please, if you can access both, as we said earlier, we are encouraging people to access both of their vaccinations.
Can I just add something to that, Yolanda? Well, it was just to say that if you are lucky enough to be able to have them both done at the same time, which would save people a bit of time, I suggest, and it's only a recommendation, it's not a you must do or anything like that, is just have them in different arms. Just purely because if there is a little bit of reaction, you know, to the skin, then at least you know which one it is. But it's not something you have to do. I'm just recommending it, that's all.
I think that's what most of the practitioners are recommending in any event, Anne-Maria, from what I've seen.
Yeah.
Thank you both. Definitely a double act today, both of you. The next question, Anne-Maria, and I'm expecting you to give a massive plug for our flu campaign here, is when and where can staff have the flu jab?
Do you know what? I've so missed not talking to you all about flu. You've had 6 months off. I'm back on it now. This is it. So the flu campaign has started. We launched it on the 21st of September. We were lucky enough to get some vaccines in last year. There was a little bit of a delay getting the vaccines, which is why we weren't able to really get on it as quickly as we would have liked to have done. But we're already out there jabbing. I'm sure you've seen it on social media and Twitter that we've got lots of our IPC team that have been fantastic at offering people the flu jab. So you can go on to Connect, and on Connect are all the clinic dates. So those are dates that are set with their venues, dates and times. But there is also the ability to have something called a roving clinic. So you can also contact the IPC team and see if there's anybody roving in your clinical area. If there isn't, and you've got like, I don't know, 5 or 10 people that are all getting together, then I'm sure somebody would absolutely come out and make sure that you're all giving your vaccine at the same time. Not a problem at all. We're here to accommodate and we're here to make sure that everybody has access to it. So yeah, where and when, there are set clinic dates, but there are also roving and we're started. So please, please, please go and book your jab.
Thank you very much.
I need to call it something different to a jab.
No, well, they call it
I don't know.
nationally, so I think that's fine.
Like it. Sometimes people don't like it. I'll think of something different next time.
I dread to think. We've got 2 more questions, which are both for you, Claire, and I'm going to use my prerogative as being in the chair at the moment to swap them round. So I'm going to ask you the first question I'm going to ask you is about the Prince 2 Foundation and the practitioner qualification. And someone asking if there's such a pathway in the trust. So it says, I'd like to train for Prince 2 Foundation and practitioner qualification. Other trusts do provide this package for their staff that are keen to prepare or progress into a change management or digital transformation role in the NHS. Is there such a pathway in Notts Healthcare?
Thanks, Yolanda. So we did used to offer it. It's not something that we've currently got available. However, we can support staff where appropriate with some external training. So I would suggest that our colleague talks to their line manager and can also talk to Kevin Warren, who's our learning and organisational development manager. And Kevin will also be able to put in some support as to how that course may be accessed, if indeed it's appropriate to do so.
Thank you, Claire. And the final question for today, I have been keeping an eye on the chat. We've not had any more questions. So the final question, Claire, is about, and I know John touched on it in his introduction, But this question is quite specific. They're asking, they say they know the staff survey has only just launched, and I know it only launched on Monday and we're only on Wednesday, but what are our response rates like at the moment? And do we think, are we hopeful that more people will respond this time than before?
Thanks, Yolanda, and thanks for the question. Yeah, so as you've said, the staff survey, National Staff Survey, launched on Monday. Really important opportunity for people to be able to provide confidential feedback. It's our go-to place each year to really inform some of the decision making within the trust. So please do complete it. So far, we've had 530 or so responses to the survey, which is really good actually in the first few days. So we're really encouraged by that. Last year, we had over 4,000 responses in total, and we'll be hopeful that we've got an increase on that this year. The more responses that we get, the better the range of information, and actually the better the range of views and understanding people's perspectives is. So we had a good increase last year in the number of responses, and we're hopeful that to see that upward trend again this year. The survey has changed from in previous years, so there are some different questions in there and some specific focuses around, I think, what more of the things that matter to people actually, so particularly around some of their health and well-being and other things as well. So please do complete the survey, and yes, we're hopeful that we can improve again on last year's response rate. Thanks to everybody who's taken the time already, and to encourage everybody else to do so. And Neil's put in a helpful comment as well. So we have really good support from our staff side colleagues as well to encourage people to fill in the survey. So appreciate Neil's support and that of other colleagues as well. Thanks.
Thank you, Claire. Debbie Morris has put something in the chat about there's a level 4 associate project manager and a level 6 project manager apprenticeship available for staff to undertake as an alternative to Prince 2. So thank you, Debbie, for that comment. Thanks, Neil, for your interaction today as well, encouraging staff to complete the survey. I'll now hand back to the boss, to John, for him to sum up today's session. Thank you, John.
Thanks very much. Yeah, good conversation. Thank you for the questions, everybody. Just the other thing to say about National Staff Survey, I don't think mentioned it, is that it might go into your trash email. There doesn't seem to be any rhyme or reason, but if you've not had it, it comes in NHS Staff Survey. If you've not got it, thinking why, have a look in your trash box, because some of us have experienced that. It happens everywhere, it's not just here. But I think they're really encouraging early figures. Thank you for everybody that have done it already. And as Neil says, the feedback's the important thing. Don't think either because you've only got bad things or you've only got good things to say you don't want to feed it back. It's vital that we get it all. So there'll be more updates on that over the coming weeks. Yeah, and then just to finish on a huge thank you to everybody for what you're all doing. We do appreciate these are really tough times, the hard yards, if you like, the initial sort of urgency and emergency of the pandemic has passed, and we're now in the sort of, you know, slog of huge demand, increasing referrals, acuity, staffing challenges right across the piece, and I know that it's really tough. Myself and the chair, Paul Devlin, had joy actually of being able to get out and to sort of relaunch our visits, and we had sort of half, 3/4 a day at Rampton on Monday, and it was brilliant to be able to get to talk to ward managers and staff on a number of wards and different teams, and also to be able to talk to some patients at the same time, and just get a sense of two things really. One, what the challenges that are being managed 24/7, but also because of the pandemic, I'd not been to Rampton for quite some time, and the sense of positive change and progress that's being made in that unit of ours, given that they've been under the cosh for so long with various regulatory challenges, and how all our staff have collectively moved it forward. It was brilliant to see. So special reference to Rampton. I know that's going on across the whole of the organisation, but they were one of the first ones on our list. And if you'd like visits either from myself, the exec team, you want to host, you want to show off, or the stuff that you're finding a bit tricky that you might want to have a conversation with us about, please let us know. Because, given Anne-Maria's caveats around outbreaks and other things, just need to carefully manage some of the locations you go to. We do prioritise that as a really important part of how we work. So to finish on a big thank you, great session. Have a good afternoon, and I'm sure we'll see you soon. Thanks a lot. Thanks, Yolanda.